Welcome to Med Madness, where we simplify complex medical topics to help you excel in your studies and practice. Today we'll be discussing an essential topic: informed consent and ethical principles, particularly in the context of minors. Understanding informed consent and ethical principles is crucial for medical students and professionals. It helps ensure that patient care is delivered with respect, fairness, and legal compliance. In this episode, we'll explore exceptions to parental consent, the physician's duties in emergencies, and key ethical principles guiding medical practice. We'll also discuss a real-life case study to illustrate these concepts in action. First, let's discuss exceptions to informed consent by parent or guardian in minors. In emergency situations where treatment delays can cause serious impairment or death, medical intervention can proceed without parental consent. This ensures that life-saving care is not delayed. Next, let's talk about emancipated minors. Minors who are considered emancipated have the legal right to make their own medical decisions. This includes adolescents who are married, serving in the military, financially independent high school graduates, or homeless. Now, let's consider specific medical care for adolescents. In certain cases, minors can receive confidential care without parental consent. This includes care for sexually transmitted infections, substance use disorders, pregnancy care, and contraception. Moving on to parental consent. Parental consent is generally required for all non-emergency medical care for minors. However, there are exceptions for confidential care and emancipated minors. While obtaining assent from the child is ideal, it is not required to proceed with treatment. Next, let's discuss the physician's duty. Physicians have an ethical duty to prioritize patient interests and provide necessary care even in challenging situations. This duty is reinforced by the Emergency Medical Treatment and Active Labor Act, which mandates screening, treatment, and stabilization of patients in emergency settings. Now onto ethical and legal duty. Physicians must treat patients with life-threatening conditions regardless of their behavior. This includes providing emergency care even if the patient's behavior is disruptive. In non-emergency settings, physicians may refuse treatment based on personal beliefs if it does not involve life-threatening conditions. Next, let's talk about patient autonomy. Patients have the right to be informed about treatment risks and benefits, select from medically acceptable alternatives, and refuse treatment. However, physicians are not obligated to provide non-indicated or inappropriate services. Moving on to ethical decision-making. When deciding whether to provide requested treatment, physicians should consider ethical and evidence-based standards, potential benefits to the patient, and the avoidance of unnecessary harm. Next, let's discuss proportionality. Proportionality ensures that the methods used to achieve a goal are necessary, reasonable, and not excessive. For example, physical restraints may be necessary in emergencies when non-restrictive options are insufficient. Now let's review the ethical principles in medicine. Beneficence means promoting good and acting in the best medical interests of the patient. Non-maleficence means doing no harm to the patient. Autonomy means protecting and facilitating the patient's individual, informed decisions. Justice means equally distributing healthcare resources and providing fair and equitable treatment. Proportionality ensures that methods used to achieve a goal are necessary, appropriate, and not excessive. Next, let's consider a real-life case study. Imagine a scenario where a 15-year-old girl arrives at the emergency department with a severe asthma attack. Her parents are unreachable. The medical team must act quickly to administer life-saving treatment without parental consent. This situation highlights the importance of understanding exceptions to informed consent and the physician's duty to provide emergency care. In conclusion, we've covered the essential aspects of informed consent and ethical principles, especially for minors. Understanding these concepts is crucial for delivering respectful, fair, and legally compliant patient care. Remember to engage with the pre- and post-podcast quizzes and use the Anki flashcards to reinforce your learning. These tools will help you master the material and excel in your medical career. Thank you for listening to Med Madness. Stay tuned for our next episode where we continue to simplify complex medical topics for your success.